Is rational emotive behavior therapy, REBT, part of CBT? Imagine a therapy that started over 60 years ago and still influences how we understand thoughts and feelings today. That's what we're exploring. Cognitive behavioral therapy is a broad approach that looks at how our thoughts, feelings, and actions are connected. Its main idea is that changing negative thinking can help us feel better and act differently. Cognitive therapy, developed by Aaron Beck, is a key part of this, focusing on spotting and changing distorted thoughts. Now, rational emotive behavior therapy was created by Albert Ellis in the 1950s. It actually came before Aaron Beck's cognitive therapy. REBT is often called the first form of cognitive behavioral therapy because it shares the same basic idea that thoughts influence feelings and behaviors. But REBT puts a stronger emphasis on identifying and challenging irrational beliefs, those rigid, unrealistic demands we often hold about ourselves, others, or the world. These beliefs are usually expressed as musts, shoulds, or oughts. The goal is to replace these with more flexible, rational beliefs that lead to healthier emotions. From a historical point of view, REBT is both a precursor and a close relative of cognitive therapy. Both aim to change unhelpful thoughts to improve emotional health. But they differ in how they do it. Cognitive therapy tends to focus on a wider range of distorted thoughts and uses structured techniques to test and change them. REBT, on the other hand, zeroes in on beliefs about how we judge events and uses a more direct, sometimes confrontational style to challenge irrational thinking. In practice, the techniques of REBT are very similar to other forms of cognitive behavioral therapy. The main difference is the focus of the beliefs targeted. REBT concentrates on evaluative beliefs, how we judge or interpret events, while cognitive therapy often addresses beliefs about what those events mean or how we infer things. Both approaches are part of the larger family of cognitive behavioral therapies because they share the core idea that changing thoughts can lead to better feelings and actions. REBT played a big role in shaping later cognitive behavioral methods, especially with its focus on belief systems and the active role of the therapist. So, to answer the question directly, yes, rational emotive behavior therapy is part of the broader cognitive behavioral therapy family. It is one of the earliest and most influential forms, with a clear focus on irrational beliefs. From the perspective of cognitive therapy, REBT is a foundational approach that helped pave the way for many modern techniques. Understanding this connection shows how diverse yet interconnected these therapies are, all aiming to help people think better and feel better.